It's Dr. Toby here. In this video, I want to show you how to relieve neck pain after a neck surgery that you thought was supposed to solve the problem, fix the pain, and address the main issue. And you still, after several months or maybe even after several years, you still have a neck pain. Maybe you got an ACDF or a neck fusion or some kind of procedure and the neck still hurts. You've been several months out, and this video is going to be able to show you the 3 things that you need to do in order to relieve that neck pain. So let's jump right into it. One of the biggest problems that you need to address in order to relieve the neck pain is you have to relax the nervous system. This is very, very important. You have to reset the nervous system, because what happens is when you undergo an invasive procedure like a neck surgery, they're cutting you open, they're affecting a lot of structures that are outside of just the main area. So even if you got, let's say, a fusion where they fuse the joints together because maybe they said you had a bulging disc or had arthritis and those discs are rubbing together and things like that, and that's causing the pain and the friction. Well, once they have to go inside to address where the main issue is, what happens is they've also already affected a lot of other things. So imagine your body is like the alarm system is going off, right? And that's your nervous system. Your nervous system is like, hey, this is an invasive procedure. It's affecting other structures, and that just aggravates things. And so you have to begin to relax the nervous system. How do you begin to relax the nervous system? Well, I'm going to show you a few things at the end. If you stick around to the end, I'll show you a couple of things that you need to do. But the other two main things that are helpful that will relieve the neck pain are going to help you to relax the nervous system. And there's what's called the SMS method. It's an exercise approach to help facilitate the relaxation of the nervous system, which is an exercise combination where you combine stretching, mobilization, and stability exercises or strengthening exercises to help relax the nervous system. So I'll show you a couple of those things at the end, but the second thing you have to do is you have to relax the soft tissue. What happens is, as our body gets used to being stuck in the same position, maybe because you're afraid of moving or you can't move anymore, the muscles in that neck area get really, really tight, and they pull other areas to become even tighter. So maybe you had your C5, C6, C7 fuse, whatever the case is, but when you start to develop a habit of being stiff and rigid, other areas that weren't involved in the surgery start to get stiff, like your upper back. Maybe you start to wake up with pain or stiffness or really can't move, or you're used to turning your whole entire body without being able to turn your joints and stuff like that. What happens is those muscles get stiff and you want to be able to relax them. So a lot of people, when we see them, what happens is they're in a position where they're starting to like rub their neck or hold their neck a lot because the muscles feel really tight and stiff and things like that. So those are some of the things you want to do. Number 1, reset the nervous system. Number 2, relax the soft tissue. Get that soft tissue nice and relaxed. You'll see a lot of people, they'll be, rubbing their neck and trying to, do different things to kind of loosen it up, but it just feels like it's hard and stony. Well, that's what you got to do. You got to start relaxing the soft tissue, and I'll show you different ways to do that. Part of it will involve stretching. Some of it will involve some massage and things of that nature that'll help to start stimulating messages to your nervous system to relax, right? So that's part of how we reset the nervous system. One of the ways that you do that is relaxing the soft tissue. That's going to happen through massage. It'll also happen through regular stretching and mobilization. So that's going to be important because we want to communicate some feel-good sensations to the actual nervous system. Your nervous system is being flooded with information to say, hey, we have a problem, continue to send pain signals so that, Mary or John start to do something about it, right? Like your body, your nervous system has to relax or be reset because it's getting messages to try to tell you, hey, fix something, do something. Even though nothing may actually be wrong, the area of arthritis or the bulging disc was so-called fixed, but what happens is your body is still getting a message and sending you a message to do something about it. And what your body wants you to do, you're not really sure about what to do. And I'm telling you that the first thing that you want to do to reset the nervous system is start relaxing the soft tissue. And then the third thing you want to do is you have to restore normal sensation. Now, what does normal sensation mean? Your body was never meant to have its disc fused or to have some of the things that you had done to it, right? So it's not used to that anymore. And it's it's wiped out some of the places where you're meant to feel, right? Like you were usually meant to be able to turn your neck all the way to the side and do this and do that and do all these different kind of things. And so the sensation is not normal. Plus the stiffness of your tissue, the scar, all of those things affect your sensation. Some of the nerves are now dead. So what do we need to do to restore normal sensation? Well, one of the first things we need to do is start to initiate movement. We want to initiate pain-free movement. I always tell people that as you start to begin to move, more pain doesn't mean more progress, but you can't avoid movement just because there's some discomfort. So you don't need to push yourself to the point of we usually give people a scale like mild, moderate, severe, right? And so where is that level of pain when you do a simple movement, turning your head to the side one way or the other? Is it, mild pain? Is it severe? Like, what is it, right? And staying within that mild range is important, but starting off even just doing some movement in areas that are not related to the neck, but are closely related, like your shoulders, moving your shoulders up and down, but also turning that trunk, really turning your body, rotating, is going to be very, very important, in trying to get some gentle head movement. Even if you don't feel comfortable moving your head, turn your head slightly and see how you can move your body in some of those adjacent areas, because that's going to begin to communicate and send a message to the brain to relax the pain sensation that it's creating. The pain that you're feeling is a signal that's coming from your brain to let you know, hey, fix something, something's potentially wrong, something's broken, something's happening here. But what happens is, through the surgical procedure, one of the reasons why it didn't go as well as you thought it was, because even though they may have affected the area where they fused, the place where they said, hey, your problem's here, C5, C6, or C6, C7, that's where your problem is. The issue is that the surgery itself also triggers a nervous system response. So it's kind of like, imagine you break into someone's house, right? And you kind of like throw off the alarm or the security system, right? It's like, okay, cool. Even if you remove the person who broke into the house or whatever they stole or whatever they were trying to do, what happens is now it's just like there is this like, you tripped out the security system, and we got to address the security system, because your nervous system is trying to protect your body and say, hey, something is wrong, things of that nature. So we got to relax that and address that aspect. So the last thing that I want to do for you is show you a couple of things that are going to be helpful. We talked about resetting the nervous system. We talked about relaxing the soft tissue, and we talked about being able to restore normal sensation, how you feel. So one of the things that's going to help you to do all of that is using a massage ball. You can take one of these balls and just begin to rub the neck. So this is really helpful. And we give this to our patients. And, people can use massage guns, but some of those may be too aggressive for folks. And what you just want to be able to do is move that around. Now, the goal is not to eliminate the pain here, or to use this one particular thing to just beat out the pain, because the pain is not just the muscle tissue. And that's the mistake most people make. They're like, well, what's the one thing I can do to, remove the pain completely? And you can do that, but it's not just one thing you're going to do. So it's not just like, oh, get a massage and that's going to completely remove the pain. You have to start by relieving the pain, reducing that, because part of what's contributing to the pain is not just anything you're feeling externally. Part of it is, it's a sensation that's being created by the nervous system. So you need to communicate a message to the nervous system to relax. So we're not just like, hey, pound the pain out by putting a lot of pressure. No, that's not the goal. The goal is to actually communicate some feel-good sensations to your body, so your body begins to not interpret everything as painful. Your body doesn't interpret turning your head or bending your head to the side as painful, right? Your body begins to say, okay, cool, not everything we do has to hurt. And once you start sending that message through some of the sensations you're creating with the soft tissue mobilization, like with this massage and stuff like that, you're going to start to see that over time, that pain goes away, especially if you get on a regimented program where you're incorporating what we're talking about, which is some of the massage aspects, the stretching, the mobilization, and the strengthening. So let me just show you a couple other quick things that are going to be helpful in that regard. So one of the things that we show people when it comes to mobilizing their shoulders to help relieve the pain from their neck is taking some weight and holding that weight. Because if you have the right amount of weight, what happens is you're going to really relieve some of that pressure from the neck area. You can even relax that head down, just like so, and just relax. And again, everyone's going to have a different amount of motion that they're able to do, but you just relax that head, and the weight is pulling down and causing some counter pressure to be relieved from the neck. So really great exercise that makes a very big difference. So the other exercise that we love to show people is taking a resistance band, and what you can do is begin to pull those shoulders together, right? And this actually helps to facilitate opening up that spine, not only of the neck, but of the back as well, the upper back that affects. So you want to keep your shoulders down when you do this exercise, keeping those shoulders down and squeezing them. Great exercise, and it makes a huge difference. So those are the couple of things you want to do. You got to reset the nervous system, relax the soft tissue, and then restore normal sensation by incorporating movement. And this is more than just doing a one exercise that's going to address the main issue, because there are a couple of things that are contributing to the pain: nervous system, the soft tissue, and then your sensation. Once you start to get on an exercise regimen that addresses that, that's going to help you to heal how your nervous system is so excited and flared up and always causing that sensation of pain or discomfort. So hopefully you found this video helpful. If you did, like it and leave a comment. Hit the subscribe button to stay connected to all the videos and contents that we make, because we want to help you to stay healthy, pain-free, fit, and mobile. And I'll see you in the next video.